Colorectal cancer is the second leading cause of cancer-related deaths in the United States for both men and women. This year alone, approximately 140,000 new cases of colorectal cancer will be diagnosed, and 56,000 people will die from the disease. That is, more than 150 people every day. Prevalence of colorectal cancer in northeastern Pennsylvania is slightly higher than the rest of the state and the nation. Luzerne, Wyoming, Bradford, Lackawanna counties are such examples. Luzerne County had 47 new cases per 100,000 residents in 2017 and 18 deaths per 100,000 residents in the same year. Wyoming, Bradford, and Lackawanna counties had similar numbers of new cases and deaths in 2017. Pennsylvania as a whole had 39 new cases per 100,000 residents and 14 deaths per the same number of residents in 2017. Men are more likely to die from colorectal cancer than women, with a death rate of 18% for men compared to 12% for women. While all of this data sound like a lot of bad news, the truth is that colorectal cancers are both preventable and treatable, especially when it's found early. The risk factors for colorectal cancer include some that we can control and some that we cannot. Age is a well-known risk factor for the disease. As people get older, their risks of developing colorectal cancer increase. More than 90% of newly diagnosed colorectal cancers occur in individuals older than 50 years of age. Having personal history of advanced colon polyps or cancer, or being related to someone who has such disease, increase your risk of developing colorectal cancer. People with a parent, sibling, or a child with colorectal cancer have 2 to 4 times the risk of developing the same cancer compared to those without such family history. Genetic syndromes such as familial adenomatous polyposis syndrome or Lynch syndrome increase your risk. Chronic medical conditions such as inflammatory bowel disease or even diabetes can also increase your risk of getting colorectal cancer. In the United States, more than 55% of colorectal cancers are attributable to lifestyle factors. The lifestyle factors include foods you consume, your activity level, and alcohol or tobacco use. The following lifestyle factors may contribute to colorectal cancer: lack of regular physical activity, consumption of red meat or processed meat, low intake of fruits and vegetables, high fat and low fiber diet, overweight or obesity, alcohol consumption, and tobacco use. Now that you know what lifestyle factors contribute to developing colorectal cancer, we recommend the following. Maintain a healthy weight by eating a low-fat, high-fiber diet with ample amount of fruits and vegetables. Eliminate processed meats such as bacon, salami, hot dogs, lunch meat, and limit beef, pork, and veal. Avoid white breads and sugary drinks as well. If you use alcohol, drink only in moderation. If you use tobacco, consider quitting. Alcohol and tobacco in combination are linked to colorectal cancer and 6 other cancers or more. Increase your physical activity. We recommend moderate exercise like walking, gardening, or climbing steps at least for 20 minutes 3 to 4 times per week. While we cannot change our age or genetics, we can take proactive steps to improve our health by scheduling and showing up for colonoscopies.
Between 80 and 90% of colorectal cancer patients are restored to normal health if their cancer is detected and treated in the earliest stages, which is why screening is so important. The most accurate way to check your colon health is through a screening called colonoscopy. Everyone over the age of 50 should be screened for colon cancer, but still 1 in 3 adults over age 50 is not getting screened. Colonoscopies are minimally invasive procedures and allow your doctor to see the interior of the colon to view precancerous areas called polyps. Since almost all colorectal cancers start as a precancerous polyp, colorectal cancer screening can be used to find and remove these polyps before an individual develops cancer. These polyps can be present for many years without causing any symptoms at all, which is why screening is so important. The screening can prevent cancer altogether by removing the precancerous polyp before it becomes cancer, or can detect colorectal cancer early. Early detection provides the greatest chance the treatment will be effective and lead to a cure. We recommend that individuals begin screening at age 50 through age 75. Some people are at a higher risk and should be screened at an age younger than 50. As we discussed earlier, 2 out of 3 people diagnosed with colon cancer have no prior family history. There are 3 methods for colorectal screening: high sensitivity fecal occult blood testing, sigmoidoscopy, or colonoscopy. Talk to your doctor about which screening method is right for you and how often you should have it done. According to a study conducted by American Cancer Society researchers, cases of colon and rectal cancer have been increasing by 1 to 2% each year among younger adults ages 20 to 39. This research also indicates African Americans are diagnosed with colorectal cancer at a younger age. So we recommend that African Americans begin routine screening at age 45. Colorectal polyps and colorectal cancer may not cause any symptoms at all, especially early on. Because there may not be symptoms, it is very important for individuals to get screened regularly to try to catch the cancer before it begins or in early stages. If symptoms are present, they may include blood in your stool or bowel movement, change in your bowel movement such as unexplained constipation or diarrhea, stomach pain, aches, or cramps that don't go away, and losing weight without trying. Other ways to help you determine your risk of colorectal cancer include genetic testing and sharing any family history of colorectal cancer with your doctor. When you come to Geisinger for colorectal cancer care, you're backed by an entire team of surgeons, medical oncologists, radiation oncologists, pathologists, radiologists, mental health professionals, and nurses. Together, our team will review every aspect of your health and condition to determine your most effective treatment plan. If your cancer care requires further surgical treatment, our surgeons are trained in minimally invasive procedures, including the use of surgeon-controlled Da Vinci robotic surgery. Robotic surgery enables surgeons to use arms that hold a camera and surgical tools. The surgeon controls the robotic arms, which allow for better visualization and a wider range of motion than traditional surgery. Minimally invasive surgery means you'll experience a quicker recovery so you can get back home sooner. Geisinger's colorectal surgeons and gastroenterology doctors offer consultations and perform surgeries close to where you live and work, and offer consultations through video visit as well. Since there are very few symptoms associated with colorectal cancer, regular screening is essential. Screening is beneficial for 2 main reasons. Colorectal cancer is preventable if polyps that lead to the cancer are detected and removed, and it is curable if the cancer is detected in its early stages. If detected, colorectal cancer requires surgery in nearly all cases for complete cure, sometimes in conjunction with radiation and chemotherapy. Between 80 and 90% of patients are restored to normal health if the cancer is detected and treated in the earliest stages. However, the cure rate drops to 50% or less when diagnosed in the later stages. In addition, studies have shown that patients treated by colorectal surgeons, experts in the surgical and non-surgical treatment of colon and rectal problems, are more likely to survive colorectal cancer and experience fewer complications. This is attributed to colorectal surgeons' advanced training and the high volume of colon and rectal disease surgeries they perform. If colorectal cancer is detected, colorectal surgery is often required. This can happen at any stage of cancer. But when colorectal cancer is caught early, survival rates are as high as 90%. That's why it's so important to have your regular colonoscopy screenings.